Hey, welcome everyone to this edition of Talks and Takes. You may notice on the screen that our good friend Blair McCaney is not with us today. Don't worry, he's still around. He's just traveling and in the air and had an unavoidable conflict. So he'll be back with us next month. And standing in his stead is Chris Stevenson, a good friend and colleague of all of ours. Many of you know Chris for many years. He's a presenter at just about any conference you want to go to. Chris is there sharing his words of wisdom. So he's been kind enough to join us today. And Chris, you got the first topic about the URSA convention and how great that was to see everybody in person. But first, a video.
Hi, and welcome to the 2021 URSA convention. We are here covering the latest trends in fitness. The best brands, the most exciting and cutting edge products are here. So come on and join us. URSA convention in Miami. We'll see you there.
So yeah, URSA was an incredible event. I know it had been a long time, but I got to say it was definitely the comeback event that sort of reunited the industry. I know personally, there were a lot of people that I interacted with over the pandemic via Zoom that I had never met in person. So it created that opportunity to get together. I think that URSA did a wonderful job with all of the COVID protocols and making sure that everybody felt safe and secure and running the event properly. But it was interesting because the one thought I did have prior to the event was just like fitness, when fitness centers were closed, a lot of people did a great job putting out virtual programming, right? And the question was, is this going to be a permanent change, or are people going to want the live experience again? And I think we were feeling the same thing sort of in the conference and trade show industry, right? Are people going to go back to live events, or is this going to be forever changed? And I think the same thing that happened with fitness happened with the events. And it was evident in how well the show went. People want live classes. They want in-person experiences, but they still want a little bit of virtual. But virtual, as what we've seen in all the data and research on the fitness programming side, supports the live experience. Right. So if you absolutely can't go, or you want some extra support or that sort of thing, that's where you're going to use the virtual solution. But everybody was so excited to be back at the live event, and it was incredible. So for anybody that had any fears that events weren't going to come back bigger, better, and stronger than ever, let those fears be squashed right now, because it was phenomenal. There was some really cool, and I think maybe having the delay in time come up with some new programming, but we had some great sessions, as we always do. We had some cool things in the Welcome Center, which were Ask Me Anything type sessions. So it was more of a Q&A, great roundtables. This new format that I was fortunate to MC called the Spark Talks, where you had 3 dynamic speakers go 20 minutes, 20 minutes, 20 minutes, and provide this great content. So new content, great energy. Obviously, the trade show was super important, because I know that a lot of organizations did a great job trying virtual trade show, but when you're going to make a purchase, you want face-to-face interaction. You want to be able to touch, feel, and hold the products. So the trade show was really important. And then just the networking and the parties were awesome. And it was, good to see everybody. I thought it was great that Liz, our new CEO, had the chance to get in front of people in person. I know when she spoke and shared some of the exciting new direction of URSA, everything from the increase and robust advocacy efforts that we're pursuing to potential rebranding and all the direction that URSA is going, I think that got everybody excited and fired up. And just overall, the energy and enthusiasm with being in person, you just cannot duplicate it. And that's not to diminish all the great content that URSA, SCW. First of all, Sara, I have no idea how you put out the amount of digital virtual content you like. I don't know if you don't sleep or how that works, but kudos to you for I got tired watching you put out content, but incredible job. But all that stuff is going to continue to go, but it will supplement these live events. And then just personally as a presenter, I did a lot of panels, as all of you did, and webinars during the shutdowns that were virtual. And it was great but being there live as a presenter allows you to tailor the message as the presentation goes to the people who are there in the audience, the real-time Q&A, and then the discussion between the members and them connecting and networking. So it was incredible. We did miss our international members, so the show was a little bit smaller due to travel restrictions, but next year, Miami, I couldn't be more excited. We'll have everybody back, including all the international members of URSA. And not that I'm counting down the days or anything to Miami, but it's 231.
Yeah, Chris, it was a really great event. And if you were wondering about the sense of community, just as you addressed, that we were talking about in clubs, it was on full display at the convention and trade show. To your point, people were just so excited to see people in person and have a conversation, exchange a hug, and spend a little time together face to face. And that really made this one probably one of the most unique ones that I've ever been to, just because of the setting and the circumstances. But it was really well done. We also had some really major players attend this one that typically aren't there, like Chris Rondo and Chuck Runyon and several others.
Well, I will tell you that I just got back from athletic business, and I just got back from Chicago with Sara at SCW, and all the vendors, partners, sponsors at URSA that I've talked to were like blown away, even though we only had a little bit north, I think, of 4,000 people or whatever. The buyers were there. Yep. And the vendors got FaceTime with buyers and they loved it. The feedback has been great. And the energy well exceeded my expectations. And I love the Spark format, like TED Talks. TED Talks are what, 18 minutes each? Mm-hmm. The Spark's 20 minutes. I love that format. And I think URSA actually nailed it. And every vendor partner I've talked to, every sponsor, has been very stoked about the business leads, contacts, networking, connection with current customers based on buyers that were present. So Brent, Liz, URSA team, well done.
Yeah, thank you, Bill. Appreciate that. Well, if you missed the convention and you weren't able to attend, you missed one of the big highlights that I heard about over and over was Dr. Cooper's message. Dr. Cooper gave a keynote. For those of you that don't know, Dr. Cooper is 90 years old. And he did a great job presenting, even at the age of 90. Many people wondered how anyone could talk that fast and share that many statistics in such a short period of time. Dr. Cooper would jokingly say, because he's always trying to talk fast enough to finish a sentence before his wife interrupts him. That's what he says all the time. But he does talk very fast, and he did a really great job. I was really proud of him at the age of 90, sharing the information. And I wanted to offer the group that didn't hear that in person the opportunity to know that you can still watch the recording. URSA has that recorded if you'd like to go back and hear the full presentation. One of the main highlights that I wanted to point out that he brought up is based on a longitudinal study done by the Cooper Center. And it was published in the Journal of American Medicine back in 1989. So, the information's been out for a little while. But because it's such a long longitudinal study, it included so many individuals in the study, and Cooper still continues to be the #1 source and database for fitness information related to health. And what Dr. Cooper really tried to drive home with people, which I think is a message to all of us in this field, is that as you see this slide, when we talk about all-cause mortality and how that relates to fitness, if you can increase your fitness level from the very poor category on the left there, the dark bar is men, the light bar is women, and move it one category over to the right, to the poor or fair category, you can reduce your risk of mortality by 58%, and you can extend your life on an average basis by 6 to 9 years. Of course, if you move up further along the continuum to the good/excellent/superior categories, there are more benefits to be had. But the message that he pointed out, which I think is so salient today, is we really need to understand and make sure that our messaging, our programming, our offerings are taking into account the vast majority of the population that we would not call, quote, fitness people, gym rats, etc., but people that just need to get off the couch and begin to move. He went on to say that to accomplish this, moving from very poor to the poor category really only requires 30 minutes of moderate physical activity most days of the week, like walking would work at a brisk pace. So I would just encourage everyone in your programming as you look forward to the future, and we're trying to figure out how to attract that 80% of the market that may not belong to gyms. This is one way to refocus our efforts.
I find that very encouraging. I find it very encouraging because I can't stand getting the fitter, all right? And that also narrows our membership base. If we keep trying to go through the advanced participant, we've got to reschedule and readjust our programming, our approach, our marketing to embrace those people that for the past 20 months have been sitting on a couch. And I think that will increase our membership base. It means that we do need to educate our staff, but I think that's very encouraging and very doable.
Yeah, I'll tell you, even personally, I walked out of that session and ordered vitamin D, glucosamine, and omega-3s, and that's not a joke. And I exercise regularly, but that message hit me hard on the benefits of that. And then we have several colleagues that, are fitness professionals, but literally since that, and they're in the industry, but it's easy to sometimes get caught up on the business and not so much the fitness personally and stop taking care of ourselves, that have made radical changes in their exercise behaviors since hearing Dr. Cooper, and they're in the industry. But to both of your points, we've been talking about this 80% thing forever. And Sara talked about the getting fitter. We tend to program like that. What's the newest, most exciting, kind of hard, challenging sort of things. But if we can take Dr. Cooper's message as an industry and help spread the words, kind of a grassroots reach, so that the general public doesn't see fitness as, fitness can be an exclusive word. You're either fit or you're not, right? So we can get out there and say, it's not necessarily about how many burpees you can do or being ripped and shredded. It's these small changes. Just get a little healthier, move a little more. We can help facilitate that. And that could be a great way to not only change people's lives, but get that 80% so we can grow our clubs.
Yeah, exactly right. Bill, do you want to add anything on to that?
Yeah, a lot of people don't know what a burpee is, Chris, because you're like the super fit over there, but I got nothing else. No, I agree with what my esteemed colleagues have shared here. And I agree, like when we talk about the next section, whenever we're ready to move into that 80%, that's what excites me, not the 20%. I mean, the 20%, they're going to do it. You could close every gym in America, every gym in the world. And that 20% or the top 10% are going to be out there lifting logs, man. They're going to stay fit no matter what. How do we impact the people that need it the most, that aren't going to do it on their own?
Yeah. And then just to wrap it up on Dr. Cooper's message, the other thing that, of course, he reinforced was that being physically active and moving in a intentional way just has so many benefits, as we all know, but he really extolled those. There's research and science to back it up about all-cause mortality, including deaths from cancer, COPD, mental health, immunity. Could go on, but he did a great job, and it was a great message. And the other highlight that I heard, Bill, is I know you're going to talk about it next, is this sort of, everybody was saying, wow, there is so much technology on the trade show floor.
Yeah, the connected fitness thing is pretty wild right now. And there's been a lot of, different pieces of equipment. Like I'm not gonna do a commercial for certain vendors, but you go back in the day with espresso bikes, right? And the interactive fitness with regard to competing against other people. And now you got that home market with Peloton competing other people. And in the commercial space, we've got eGym, we've got Technogym's BioCircuit. We've got a lot of different things out there. And so what we're jazzed about on the connected fitness arena, the technology aspect. First, let me go back and reset. We don't believe technology is a solution without human touch. Okay. And so I think we all agree on, you got to have people helping people, social energy, mental well-being. But when you plug in the technology aspects of connected fitness, it does a few things for us. It allows you to program an individual, a patient, a member, a client, whatever you want to call them, into a workout routine that not only is personalized for that person, but it remembers that person. It adjusts the seats. It measures the outcome. It measures the efficacy of the workout. It allows you to report that back to a physician or medical professional if you want to, or just use it internally. So it's a closed loop system. And what we've learned in fitness, to traditional health clubs is open loop systems don't work. Let's set up our new member for an orientation. They may or may not show. Let's have a fitness director call them and follow up. They may or may not get a hold of them and get them into an assessment. Let's get them after the assessment to a program design, a personal training session, whatever you call it, an orientation. May or may not happen. Many clubs that I consult with may have 35% of their members that join go through some kind of fitness orientation program. Some clubs that are really rocking, get up to 50, 60%, but still it's not 100%. So what these closed loop interventions with technology in these systems, they allow you to measure, personalize, and be effective at scale. And the efficacy of whatever you measure, customize, and measure the outcomes allows you to now be a participant in the continuum of care for an individual. Now you can say, okay, I got a patient that's inactive. I put them on a program. The program, the equipment remembers them, gives me the outcomes, adjusts their progression, and I can monitor that. That's an 80% game changer versus the 20% that are doing it on their own. So I'm bullish, I'm high, my whole team's high, Mike Rucker, Michelle Wong, we're high on this integrated fitness in the medical integration continuum. And it's a big deal. I used to think that, big data was going to be, a panacea, was going to be a blockbuster. It's not about big data. It's about measuring outcomes and personalizing efficacy on scale. If you want to scale, you've got to have systems in place, and that's technology, digital technology, and business practice technology with human connection. And so I think if you're not paying attention to the connected fitness space, you're missing a huge opportunity to grow your business exponentially. But colleagues, what do you think?
Well, I think it's got a foothold and a strong one in the business aspect of what we do, but it's also really effective at supporting healthy lifestyles on a broader scale, right? Just to your point. So many people are motivated by tracking, and they're holding themselves a little bit more accountable. So it's not only about the outcomes, although that's a great thing about it, but it also supports people's healthy behaviors by keeping them engaged, giving them a little bit of accountability, giving them feedback on the progress they're making or perhaps not making so that they can make adjustments.
But Brent, you and I have talked about this one second, Sarah, Brent and I have talked about this many times. So I just want to highlight this point. Whatever you measure, you get more of, right? I think we all agree on that. And this allows a measurement of an individual's progression based on their own benchmarks versus arbitrary. Go ahead, Sarah.
And I think the measurement is huge, absolutely huge. But I also think the gaming aspect of all this is engaging a younger population to get involved with fitness programs, and also keeping them motivated to stay with our gyms and with what we have to offer. We've seen a definite younger generation, like our attendance at conferences, our attendance at live stream events has also dropped by about 3 years. Yes, an older adult population is a little more scared to go out, but the younger population is getting more engaged. And I think it's because I can measure my heart rate. I can compare it to somebody else. It's going to be fun. It's going to be a challenge. It's less of we talked about fitness being a scary word. It's less of a workout. It's more fun. It's more game-like. So I think technology is definitely affecting our health aspect, how we're going to integrate with our physicians and our, frankly, even our insurance companies, but it's also just going to make our fitness experience more enjoyable.
Brent, I got to add to that. Sarah, thank you. That's awesome. There's two aspects to that. There's gamification and entertainment, which is connected fitness, but there's also connected fitness in a programmatic standpoint. Like there's a product out there now called Sit to Stand, which is a great product, geared towards an older population. And so you have the connected fitness towards medical integration, and then you have entertainment connected fitness with entertainment, gamification, and all of those fit into that model of technology depending on your audience. So I want to just bifurcate. There are different places in this whole connected fitness arena.
I think you guys sort of covered all aspects of that. The one thing I will say is historically I was pretty tech adverse. And I realized that that wasn't going to get me very far. So for those of you who aren't really doing any connected fitness yet, it can be overwhelming with, Bill, just in saying that you mentioned 10 different options, right? So what you want to figure out is what you're trying to accomplish, what would matter most to your members, and just start small. Start to connect in a certain way. And then as you start to really drive that, then you can expand that. But don't think you've got to find 10 solutions to implement right away. Figure out one thing, what's going to make the most impact, what matters most, and start small with that, and then grow that and move on from there.
Great. All right, Sarah, what does it mean? 2020 is not the 1920s, huh?
I think we're going to talk a whimper, not a roar. Here we go.
Right.
So I think this is pretty interesting because originally about 18, 19, 20 months ago, we thought we were going to come back from this wonderful pandemic, and we were just going to roar in like the 1920s. Well, I'm sorry, but we're coming in like a whimper. So we expected to get this huge influx of memberships and people craving social connections. And we chatted about this over and over again. And the reality is we're coming in more like a whimper rather than a roar. And it's something, we can't be so negative about it. We just have to be aware of it and how we're going to address this. Because when we first went into the pandemic, we were forced to isolate. That was it. We were forced to isolate. We didn't even have a choice. Now we have a choice, and this makes it even harder on us. I found it personally much easier to transition from live events to virtual, from a live club to an on-demand program. But I'm finding it much harder to go from virtual back to live because people are cautious. People are very careful, and they're very frightened. They're frightened because we've gotten mixed signals all the way along. So what we need to look at is we need to go not into a new normal. We have to look at the next normal, how we're going to address this. Yes, we know our methods of communication, what's going to happen, this disease burden. We haven't hit herd immunity, and I don't know if we really ever will. And we have to track our progress. We have to see what's going on with social media, stay connected to your clients, stay connected to your staff, see what's morally acceptable as far as vaccination requirements. And we have to look at our geographics and our demographics. We know this from a management perspective, but then we have to set practices. And that's what's scary. We're kind of stuck with all this stuff. We're stuck with this. It's kind of like we're all going to be the seatbelt example. We're all going to be driving cars. So there's a seatbelt requirement. We have to make sure what is the speed limit. Are we going to restrict different people from driving cars, like if you're over 95? So we're going to set this. And if we do something, if we look at our epidemic, if we close all chains, it's like Ebola, and we completely eradicate it. We're more likely to be managing this. It's going to be more like tuberculosis and the flu, and maybe even the smallpox, which was we got rid of completely. So if we're going to be like tuberculosis and the flu, we're going to have these annual vaccines. Are we going to require this, and how we're going to educate our staff and stay connected with our members? So what do you guys think?
I think that there's a lot to unpack there. I'm pro-vaccination personally. Like, I'm vaccinated. I believe it's a right thing to do for most people. I think it's a good idea, but I'm also pro-choice in people protecting their own bodies and doing whatever they feel is right. So we've never required anybody to get a flu vaccination. And there's a lot of people that die from the flu every year. And so I struggle with some of the mandates in some of the areas, but I also agree with it's probably a good idea, right? And so, in the military, you've got to get certain vaccinations to go overseas based on certain diseases that are present overseas. But that's a choice you make when you join the military to put yourself in that situation. So I'm still a little conflicted on the mandatory stuff. I'm pro-vaccination for my own personal beliefs, and but putting a chemical in your body seems to be like something that might be mostly your choice.
And I think I agree with you, Bill. And I think the message is, you don't have to make this as a personal choice. Look at your demographics, look at the geographics of your community, see what's acceptable, and stay connected to the changes. Just yesterday, Pfizer just said 5-year-olds to 11-year-olds can all get vaccinated now. It's been approved by the Federal Drug Administration and the CDC. So
I think the dosage is a third of an adult dosage that has 94% efficacy or whatever. But to your point, like beyond the vaccination, pro, con, mandate, not mandate, we have to deal with this situation from a protocol standpoint in our facilities, right? That's the bigger issue versus personal beliefs. And we have to be respectful of other people's positions, right? And so, and this is gonna keep ebbing and flowing as we navigate that. But I will tell you, I think we may have talked about it last Talks and Takes. When they banned smoking on airplanes, people freaked out. And when they implemented seatbelts, people freaked out. Like, nobody wants more government intervention, or at least most people don't want more government intervention. And when the government steps in to try and protect the safety of a population, of a populace, it causes people to go, hey, wait a minute, I got personal liberties, personal freedoms. And we are trying to balance this personal freedom with the safety of the whole population. And in our microcosm of health clubs, we've got all kinds of people that have different beliefs, and we got to protect our staff first and foremost, and we got to protect our members. And so I still go back to the same thing, which is follow the local jurisdiction guidelines for where you operate.
Yeah, and to bring it back to the club space, there are clubs and organizations that, to my knowledge, and I know this is true, some have determined and made it mandatory that their staff are vaccinated. Otherwise, you cannot work for that organization. And there's been obviously some fallout. Some people have left because of that. I'm not sure there's a club out there that has taken the stance that every member or consumer that enters their building have to be vaccinated. That's a whole nother step. You know of one, Bill?
One of mine in New York, but it's mandated by New York.
Oh, that's right, New York. Yeah, I'm
but,
sure California.
But that's primarily, governmental regulation. I think my message really is there's not going to be like an opening of the curtain and everybody's going to come roaring into your club. We've got to be patient, hang in there, plan appropriately, because it's going to be an up and down and up and down protocol.
Yeah, I think whatever decisions clubs make, I mean, obviously you have to follow local mandates, as Bill said, but we are in an era of people expect brands to make decisions and to decide their protocols. In the past, brands should have to walk the fence, and we don't take a political stance, but now consumers expect a brand to be on one side of an issue or another. So whatever it is, based on your vision, mission, values, and what your brand stands for, that's how you make your decisions, right?
Yeah, but Chris, this is interesting. Like, so what's the brand to do? Like, take me, for example. I believe in vaccinations 100%. I think if you're not vaccinated, you probably should stay home until this all, passes somewhat. But I also respect people's individual rights and liberties. So what's a brand to do with regard to a geography where your consumers have certain beliefs, and in different markets, like some of my markets, everybody wants to be vaccinated and they don't want to go to a gym that's not vaccinated 100%. Other markets, nobody, we don't care. They don't care if anybody's vaccinated. Let us just be back to normal and have our liberties. Like, so how does a brand, dictate that, especially a regional brand or a brand that's not, nationwide? Like there's brands like Equinox, which they're nationwide, but they have a heavy concentration in the Northeast, right? And so what are you saying, Chris?
I'm not sure. I'm going to jump. I'm sorry, Chris. I'm just going to jump in for 1 second.
Put Chris on the spot.
Whatever. But Dennis made an awesome chat box. He said, if you have more than 100 employees, you soon will have the choice made for you. So maybe I'm going for fluid. Listen to your environment. Listen to your geographics and demographics. Sorry.
Whatever you
sure.
do decide, you stand by it. You communicate to your staff and you say, this is our reasoning and this is what we believe in.
Yeah. And it is very geographically driven.
Mm-hmm.
Okay, Chris, take us to the next topic, sir.
So first of all, thank you again to all of you for allowing me to be Blair's stunt double today. I do appreciate it. I will find a way to work member experience and customer journey in here at some point.
Wait, you got to get a poker room. You got to get a poker room reference too.
Yeah, poker room reference. But also my first time doing this, I'm so excited to have the uplifting topic that loneliness kills. So I'm glad that you guys let me talk about the loneliness kills topic. But basically, the gist of this article was, human beings are social by nature. And when you go back to sort of primitive era, you had to be, because everybody sort of had their certain job and it was all about survival. We're talking in primitive days, right? Like somebody was the hunter, somebody was the person who took care of the young ones, somebody who was the protector. Everybody had those jobs and it was an absolute necessary thing. So as we evolved physiologically to be social creatures for pure survival. Now, many of us hopefully don't have those same challenges of running out and hunting food. And if I don't find my food, I don't get to feed anybody. But
Brent lives on a ranch. He might be out there.
I'll find out in a couple of days. But while those have changed, our physiology and the need to be social has not. That has stayed intact. So in looking at this article, Harvard ran a study that ran for about 75 years where they followed people. And all of these people went their different ways and had different lifestyles, different relationships, some married, some not, some kids, some not. And even in the study, they started following their children. And they kind of came up with this conclusion that social activities, good quality relationships, improve your physical well-being as well as cognitive brain function. People had better memories and they had less of a decrease in brain function as they aged. So it was cool to see, I guess there's a correlation. Hey, I think if you exercise, you feel better. And I think if you exercise, you have better brain health. But this study showed without a shadow of a doubt that social interaction is a key to being healthy. I just have a couple of takeaways here. They said, loneliness kills, and 1 in 5, if that's the topic, 1 in 5 people in America say they're lonely. So, that's a bad situation. They also talked about the quality of a relationship matters. And it was reflected in the study that people that reported having good quality, consistent relationships at the age of 50 were much healthier physically and had better brain function in their 80s. So that was there as well. And then just the fact that this has an impact. So I think my biggest takeaway from hearing this is, we are in an industry that thrives on being social and bringing people together and creating environments. So how do we as operators continue to provide more opportunities for our staff to bond with members and create solid relationships, and then members to bond with other members? And that's getting them involved in programming together and creating social environments for them to, create your clubs inside your clubs. So I think that's a challenge moving forward, knowing the impact of this study that relationships matter both physically and mentally. I think it's our responsibility as clubs, and it will help us be more successful, of finding creative ways to bring people together.
Yeah, it's such a serious item, and really it tends to affect, I think, the elderly population more so than others. And I can look at my parents, the one of whom passed recently and one who's still living a relatively independent life. But that loneliness factor really comes into play for so many people, and having those relationships that are good, that they can rely on, that's something the clubs can offer, really. I remember when I first went to the Cooper Aerobic Center, this is some 20 years ago, we had a really senior crowd that would come in, and I swear they wouldn't work out more than probably 5 minutes, right? They'd drink the free coffee, they'd sit in the lounge, they'd read the free newspapers back when newspapers were still being distributed. And I would think to myself, come on, people, you're here to exercise. And over time now, as I've maybe grown a little older myself, I'm like, man, what a service that was, just to give them someplace to go to connect with other people, whether they walked around the track or they didn't, really doesn't matter, right? That social component, when we really think about someone's well-being on a holistic level, is so important.
Hey, Brent, can I add to that? Like, I think you're dead on in everything you said, but there's also adolescents and teenagers. There is so much emphasis on fake perception of okayness, right? Like you're not a social media guy, Brent. I've been I've been following you and you don't even know I'm following you. But kids and adults put this best life forward on social media that doesn't exist. And there a lot of people are dealing with shit that they don't want anybody to know about. And so your staff, when we talk about staff, they may seem okay, but they may not be okay. Like, we got to peel it back a little bit in our relationships to really get to the bottom of, is this person really okay? And am I really being there as a good friend and a good colleague, and so on and so on? Because the adolescent suicide rate, the pretend image on Facebook and Instagram, you know, the life that doesn't exist but is portrayed, like, we don't know what's behind the veneer. And I'm shocked, Chris, that it's 1 in 5 that are lonely. I would have said it's much higher than that.
Well, and I kind of agree with you. I agree with both of you, which I know you find surprising.
Whoa.
I know, Bill,
hey,
whatever.
When Blair's on here, everyone fights. I'm just saying, when I'm on here, everybody gets along.
Yeah, right. Okay. So, but one thing we have to think of when we talk about loneliness is we have to think about, like what Bill brought up, the virtual connections. They cannot replace the face-to-face. They absolutely cannot. I've had issues, let's say, you know, with friends that have been through text messages or an email, and there's misconceptions or misperceptions on things where people you can't read tone into an email or into a text message. And I get to see them face to face, and it's like we look at each other and there's a heavy sigh and a big hug. And it feels different, it tastes different, and it smells different.
Wow. Yeah, and Bill, to your point on the 1 in 5, I'm sure that's self-reported, and there's probably only 1 in 5 that will admit to feeling that way because maybe it's embarrassing or they feel bad about it. Mm-hmm. Really quickly, back to sort of the tactical piece. My son just finished his football season, and I said, "What are we doing next? Are we doing basketball? What's the next deal?" He goes, "No, I just want a gym membership. I'm gonna go with my friends." And I was like, "No, because I don't want you, even though that's a somewhat social environment." I go, if it was organized programming that I could count on to be a good social environment, but I don't want him just at a gym screwing around, right? So again, as operators, creating really deliberate ways to socialize adolescents in a very positive way.
Did you just knock the gym industry, Chris?
No. I knocked my son and his ability to behave in a socially appropriate way.
That's so much better, Chris. I'm so glad you threw your son under the bus on that national audience.
You're a real positive influence. Thank you for joining us.
So we found a different facility that did offer specific youth athlete programming, where now he'll be with appropriate peers in a positive environment.
Is that Adam? Are we talking about Adam?
No, Adam is social and he's appropriate everywhere. But Brent, to your point too, really quickly, I remember my first experience when I moved to California, when I was just teaching a group exercise class. Same thing. Some of the older members at the club spent more time in the locker room, you know, in their towels, sometimes not in their towels. Right. But just having these conversations, it like tripled the time they spent on the floor. So their whole well-being came from just being there and having a facility to come together in.
Right. And so important. All right. Well, this is somewhat related to your topic, Bill, next about the lower mortality rate and medical fitness facility use, et cetera. There's some good research that came out of that.
Yeah. Do we have a graphic we're going to show on this or not?
I believe we do, sir.
This will be kind of a quick topic for me, and that's kind of unusual because this is my space. I love this research. I love the fact that that over a long period of time and many clients, we saw a major reduction in mortality and hospitalization. But the lawyer thinking in me, the Socratic method or whatever, Sara can correct me on the right terms, but there also is the aspect of correlation versus cause. And so when I look at this study, I love it. I love it because I believe in it. When I have clients that engage in medical wellness, they get results, they live longer, they have a higher quality of life. And sometimes it's not even about the length of life, it's the quality of life. Like, I hope that I live to wherever I live and I drop dead, but that I functioned and had a high quality of life till the very end, versus 10 or 15 years of chronic care where I'm not functioning, at any kind of measurable enjoyment in life. So
Dr. Cooper calls that squaring off the curve, Bill.
Okay.
Everybody wants to square off the curve at the end.
Yeah, very good, Brent. Thanks for that. So my point being is that we know that medical wellness centers help people support healthy lifestyles, which reduces mortality and hospitalizations. Now, what we may not know is people that go to medical wellness centers might be already self-selecting into a proactive standpoint. Again, I go back to the 80% population. So in my medical wellness centers, I want to have programming that tries to attract those people, to Brent's point, that to get people that are in poor condition, to get them to fair condition, or Dr. Cooper's, from very poor to poor, from poor to fair. If I can do that, to Brent's point, and add 6 to 9 years of quality life, that's great. So the point about this research is medical wellness centers help people live longer and stay out of the hospital, but your medical fitness center has to program to attract the 80%, because we still need to get those that aren't self-initiated. We still need to get those people that haven't self-selected that they're going to exercise anyway. So having the programs that impact life in a positive way, Parkinson's remediation, big deal for Parkinson's patient. Arthritis. I'm not going to go through the list of wellness programming integrated that anybody can plug and play that are out there off the shelf already. We've covered that in previous shows. But paying attention to medical programming and what the medical wellness centers are doing and adapting some of that modality into commercial health clubs is a smart idea, not only to attract the 80%, but to have a bigger impact on people's lives.
Yeah, one of the roundtables that I lead has 4 medical wellness operators on it, one of which was interviewed in this article, Sue Boreski with Refit up in Canada. She's got a beautiful facility up there. And even though it's refit and it is a medically based facility, it is extremely well done. It's beautiful, has a huge indoor restaurant that gives a sense of community all about it. So she does a great job up there. One of the things I've seen in the conversations with them is medical fitness facilities are still doing all the medical things and based on the outcomes and the programs that Bill mentioned, but they're also skewing more toward how to create this sense of community among the membership and attract an audience broader than what they've reached before, which might be people with pre-existing conditions historically. So the medical fitness facilities are trying to become a little bit more like public facilities, and health clubs and gyms are trying to become more like the medical fitness community. So there's this sort of merging of paths, I think.
Well, we had a commercial health club community center in Petaluma, California, and we had a medical wellness center in Napa, California. And then we converted the public facility in Petaluma to a medical wellness center. But what we did was we merged into the middle, right? What can medical wellness learn from commercial? What can commercial learn from what medical wellness? And how do you make it attractive to I hate to say cradle to grave, but how do you make it attractive to multi-generational customers? Right. To where it's relevant. There is no older person that I know that wants to go to a senior facility, right? People want to go where things are cool, happening, hip, programming, latest trends. So, but with extra attention, extra programmatic safety and protocols and efficacy. So there is no clinical medical wellness, like learn how to adapt to consumers.
Okay, very good, Bill. Well, so the next study was done by a third party, the top 5 things Americans consider when choosing a gym. It was by a third party, a syndicated outlet that surveyed the population, and their findings were 5 things. And here, this slide highlights 3 of them: location of the facility, the value of the facility, what type of equipment the facility had. And the other 2 are shocking, not so, is cleanliness. We've heard that for as long as I can remember. And then finally, atmosphere was the 5th one. As we think about the results of it, I don't think there's anything in here that surprises everyone, but we felt it was worth sharing with the audience just to reinforce once again that in spite of COVID and all the changes that have happened with the closure of facilities, certainly around the US and around the world, the consumer has a few less clubs to choose from now, but the things that have always been important continue to be important. Location, you can translate that into convenience to the consumer. The right equipment, the question would be, you know, how do you determine what that right equipment is perhaps, but are you picking and selecting and offering equipment to serve the audience that you're hoping to attract? The right kind of value proposition, which is not only related to price point, but also, again, programmatically, what are you providing as a provider and a servant to the community that they can't get elsewhere, that creates this value about what you're all about, regardless of where your price point is. And again, cleanliness, we've heard that for even back when I just started many years ago in the industry. We knew cleanliness was at the top of the requirements, and in post-COVID times, I think that's absolutely going to continue to be the case. We've learned a lot of lessons. Most clubs that I've been in recently during the COVID era are cleaner than they've ever been. And I hope that that continues for sure. And then finally, the atmosphere, the ambiance, the non-intimidating, welcoming environment that we all hope clubs create. That's something we've always got to continue to focus on.
I really like when we talk about value. I think these 5 elements have never changed. They haven't changed over a decade. Okay. Right. And I think we're all pretty much in agreement. But I think the definition of value has changed. I think the sense of belonging, value, like you said, is not, like you said, Brent, it's not about money. It's not about, well, I'm going to pay less, but I'm going to get more. What is that less? What is that more? Am I going to feel connected to the membership? Am I going to be welcomed to the welcomed by the staff members and embraced by the staff members? Am I going to feel safe and comfortable? So I think the definition of value, while the 5 elements remain the same after this pandemic, or we're still in this pandemic, I think the value proposition has altered significantly.
Yeah, and I think it's like you said, nothing much has changed, but it's very empowering, and it's a good reminder that outside of location, because, you know, for the most extent, you are where you are, those other 4 things are directly under your control. So if you put the time and resources into making sure you've got the right equipment, the right programming, that your place is, you know, super clean, and that you're training your staff to really properly engage with members, and that you're the best value in fitness for what you're providing, I mean, that's massive. So be empowered as owners and operators that most of your success is going to be determined by you and you executing in these 4 areas. I do think cleanliness is, you know, obviously more important than it's ever been, but it's funny, shouldn't it have always been important? And like, you know, certain clubs, when you get your surveys back and they're like, wow, you guys are really clean. That shouldn't be I mean, it should just be a normal standard, but you know, I think our industry kind of sometimes was notorious for maybe not being as clean as we thought. So I agree. I hope that stays, and that just becomes a given that every gym is clean.
But Chris, I have to disagree with something there.
Finally.
Well, somebody has to, directly under your control. You've got to be kidding me. You know, not everything is directly under your control. We don't members aren't coming back. We don't have the money we used to have. I can't buy the equipment I want and I need. So I have to adapt. So it's not under my control. I still have a pandemic. I still have lower membership.
Sara, I have to disagree with you.
Of course you do.
But when you talk about value proposition, right, which is what Brent was kicking out here, there's 3 components to value proposition, the way I frame it, right? There is the product useful to the consumer. Does it serve a need? Is it usable? Does the consumer have confidence to be able to use and execute on the product delivery? And is it desirable, right? And even if you can't afford equipment and you can't control consumers coming in, you can control usefulness, usability, and desirability. And so honing in on that, to Brent's point, with location, convenience, equipment selection, value proposition, non-intimidating environment, so on, so on. I talk about it. I'm very comfortable in selectorized equipment cardio. You put me in a heavy weightlifting area, free weight area with squat racks and deadlift platforms, and I'm a freaking infant in a fetal position crying. You put me in a Zumba class, I got no confidence. And consumers don't have confidence about lots of things. They don't have confidence about lockers, the mobile app, checking in, signing up for a class, so on, so on. So usable, useful, desirable.
Yeah, but I would pay money to see you in a Zumba class, Bill.
Dude, I could rock it as long as I'm in the back and nobody's looking.
Or had a couple cocktails right before. I think that would be a really good Zumba class.
Bill,
But Sara, to your point, we've all heard the term, what got you here is not going to get you there. So adaptability is key. But when you look at those 4 specific areas, you're going to adapt each 4 of those areas to reflect the current expectations of the consumer. So when I say it's all under your control, there's always external factors. The competition opens next door, or the economy goes bad, a pandemic hits. There's always those external factors. But when you at least have the ability to control the controllables, you can handle things a lot better.
Okay, that was a good backpedal, and I agree with that.
Yeah.
It's hard having an attorney on here.
Yeah. Yeah, those darn attorneys. Okay, Sara, we're going to throw it over to you at the risk of endangering the entire show for the next topic. But here we go.
We have a little video.
Team members.
So first of all, I have to thank my team for putting together this video. Sean Senejan did a video, Adam Budacavalli did a video, and they're really generous with their time, and they take a lot of care. And I was also terrified to have them do this because, you're worried that your team is going to quit. Do you know that 55% of all staff are looking for new jobs? And the Great Resignation, we talked about it last week, but I read a really interesting article from McKinsey, and it talked about how are we going to retain people? And that's what we want to look at. We want to look at the silver lining. Find the hidden gems in your staff. Okay, and I'm talking about the people that maybe don't make as much money, but they're the ones at the front desk welcoming people into the club. They're your personal trainers, your group fitness instructors, and your key members. Are they happy? Are they posting on social media? Connect with these people, encourage them. They're your hidden gems, keep them. And mindset matters. And that means that we can't just set an overwhelming one-size-fits-all package. Boom, let's give everybody a 10, 20% raise, keep them all in. It's not just what they want. They want training. They want different work arrangements. They want, connection and communication with our leadership. And then retention is more than money. And there's 5 actions that I really like that McKinsey noted. 1, praise from a manager. 2, attention from the leaders. 3, frequent promotions. 4, opportunity to lead projects. And 5, chances to join the management or standard setting groups. So think about how you can take those hidden gems and those top salespeople, et cetera, get them more committed and more invested in your facility, not just through increasing their salary, but making them feel like they're part of your change and they're part of your success.
Yeah, this matches an article by the Harvard Business Review that I was looking over not too long ago for a presentation. And they said 3 things you can do to keep your employees engaged is 1, make sure they feel like what they're doing is meaningful, regardless of where their position is, how it's contributing to the bigger picture and helping the lives of others. Number 2, empower them to do their jobs, give them the tools, knowledge, resources to do their jobs well. And number 3, to your point, acknowledge or recognize them. Gallup followed that up and says, which shocked me because I thought, I've always been pretty good about recognizing employees, but the Gallup survey says you should recognize employees in every 7 days, your direct reports. And I thought, oh my gosh, looking back, did I acknowledge all my direct reports like every 7 days? And I'd have to say no, but that's a pretty high bar. But recognition doesn't mean giving them a gift card or giving them a bonus or writing a handwritten note. It could just be a passing comment, right? There's a lot of ways to give recognition. It doesn't have to always be way over the top, but the thought process of acknowledging people and appreciating them so frequently really struck home with me.
Dude, you haven't recognized me in 7 months.
Bill, I sent you a nice text and email just last week.
Oh, that's true. Sorry about that. You're right.
I find one thing that really works well for me is, and it helps me also try to survive this pandemic, is I'll send a text, I'll make a quick phone call, I'll write an email, and it's not about anything really task related. It's just a general comment without letting the conversation or the text or whatever drift into anything business related. It's just a compliment. And that also makes me feel good as a leader and a little bit more involved with people, but trying to pick somebody else out every day, I don't know, feeds your soul.
And I think what both of you have shared, obviously, financials are important. Fair pay is important, raises, bonuses, those things. But a lot of us, as we're making this comeback, don't necessarily have the room to do those sort of financial rewards right now. So everything you guys mentioned as tactics, the gratitude, the appreciation, the reminders of purpose are things that don't cost anything at all, but have a massive impact. And again, to sit here and say gratitude is important. Well, yeah, but like as Brent mentioned, the Gallup Q12, when you look at those 12 questions, and for those that don't know, Gallup is the foremost expert company on employee engagement that have been studying for years and years and years. If you analyze those questions, they all fall in to exactly what you two were talking about. So just taking the time with gratitude and being, frequent and timely and specific, when you can say, thank you, here's what you did really well, and here's why it's so important to our mission as a company, that stuff matters. And, to Brent's point, we all think we're pretty grateful and we probably just don't do it enough. And I think the other thing is all of you in leadership roles, because I've worked with a lot of leaders that are like, I don't know why people just don't do their job. Well, we're wired differently, right? We might not need pats on the backs as leaders. We're just driven and we go, but your staff isn't like that, especially in times where things are still a little uncertain and, we're whimpering, not roaring right now. They need more handholding, reminder what they do is really important, and that gratitude expressed frequently.
Yeah, if I could add one other thing and challenge everyone listening to the call, just think for a moment, if you would, about your top 10% best customers, the people that come the most frequently, that are your promoters on MXM, there you go, Blair, that are spending the most money with you. How do you treat them? What are you doing special to make sure that you retain them as customers? And then once you get those thoughts in your head, then I would ask, are you doing the same things to keep your staff with you? Or are you just taking for granted that they're getting their paycheck and they're getting the training and they should do their job? We should be treating our employees better, actually, than we treat our very best customers.
Yeah, I agree. And Chris, I shared the Gallup 12 to the audience in the chat box.
Yeah, it's really powerful.
Thank you, Bill.
Yeah, you can't have happy members without happy staff. And so, and the higher you are in your organization, the more you have to develop team members to deliver for the consumer.
Right.
So,
Chris,
recap time?
No, we got one more, Bill. We don't want to leave Chris' last topic out. Les Mills' research on the latest fitness trends.
Yeah, I don't want my last topic on the show to be loneliness kills. Let's do something a little happier, a little more positive. So the Les Mills 2021 Global Fitness Report, they use a research firm called Qualtrics. They had over 13,000 participants, 15 countries. 7 different languages, and they were trying to predict consumer behavior post-pandemic, right? What are people thinking right now? And a couple really interesting and very positive takeaways. They called one of the things the live revival, and it said class attendances have been 120% of what they were pre-COVID numbers, which is interesting, I thought, when I read that, because memberships generally aren't quite back to 100%, and attendance isn't quite back to 100% for general membership. However, classes are at 120%. So that just reinforces the importance of, group exercise classes, the socialization. People want to be in groups together. They talked about another thing called the human factor, which was 2/3 of gym members prefer working out together as opposed to alone, with fitness classes, again, being cited as one of the main drivers in that situation. So again, just reinforcing that whether it's small group training, large group training, group exercise, all those formats are important. And to everyone's point, not just high intensity interval training. That might be one of your formats, but things for, our aging exercise, or in things for, some of the other populations. Then they had one thing they called the secret sauce. And this was interesting as well, but live classes are 2 times as appealing as live stream options. However, 80% of people still plan on doing some sort of virtual solution as part of their overall fitness program. So basically, hey, they all want to be live, but this virtual thing is still going to keep going. But here's the one thing I want to kind of just throw out to you guys for a quick discussion on. So 27% of exercisers describe themselves as beginners. 81% said they are super interested in training in groups. 66% said, however, we prefer to be alone. There's a gap right there. So you've got people saying, I'd rather be in a group, but I prefer to do this alone right now. So there's a confidence aspect missing to that, where people aren't feeling confident, even though they're super interested. I'm just gonna do it myself because whether I don't think I can, or I'm not capable, or I'm not fit enough. So I think, what do you guys think? As a challenge as operators, it's our goal to build confidence with members that consider themselves beginners, to get them involved in group fitness. Granted, because once you're involved in group programming, your retention's better, membership's longer, you attend more often. There's just so many benefits.
I think that's one of the great things about the virtual offerings of Group X. And I use that term, in a really broad sense, because I think not only does it make it more convenient, of course, that's a given, but I think it also gives people an opportunity to try things. Like my wife and her best friend work out upstairs here, virtually every day. And some of them are virtual classes. And I've seen them try some formats they would never go to in a club. Mm-hmm. and have fun with them and get good at them in a very short period of time. But they would have been a little hesitant had it been in person. But when you're up there by yourself watching it on TV, there's nobody to make fun of you or judge you, except me in the background.
Sara, do you know anything about Group X programming?
I don't know. I've read a few things, or Bill sent me some, I'm not sure. But this study, which is interesting, it was primarily done on virtual users. So you have to look at where they're coming from. A lot of them are just choosing to be virtual users, but a lot of them were just forced into this. So I think that's where your gap is, Chris, in this. I think people do want to work out in groups, most definitely. But I love the aspect like that Brent just brought up. I can try something new without being humiliated, or at least humiliated by people other than my family members.
Right.
Are they mutually exclusive? For example, I like to work out alone, but I like to be around other people, right? So like if I go to a class, there's other people there, a cycling class, but I'm alone. Like, are they mutually exclusive, Chris? Like, can I be alone and still part of a group because I want human energy?
Well, I think society is also changing that. If you notice what happened for the American College of Sports Medicine, they set their top 10 trends. It was only in the past couple of years before the pandemic that they acknowledged group exercise made the top 10, which I thought was kind of like, hello, what are you thinking? Primarily their evaluation is done on personal trainers and club owners and the medical community. Yet with SCW, our evaluations of trends are done primarily by Group X people and personal trainers, frontline folks. And Group X has always been up there, but I do think this craving for individuals, we're just wired this way. We are community-based, but we have to acknowledge that I always say actions create habits, habits create lifestyles. Our actions have been, don't go outside, wear a mask, and live by Zoom, live and die by Zoom. Actions create habits. So we're just used to being alone. And now what we have to do is readjust. Be patient with your memberships. They're going to come back. Small group is the way to start, separating people by dots, keeping them 6 to 8 feet apart. And I think we will ease back into this through intentional actions.
Thanks, Sara. Bill, do you have some wrap up for us? Do you remember what we said the whole way through?
Oh yeah, I got it all right here, brother. Rapid fire. We started with Chris, Ursa comeback event. Ursa knocked it out of the park. Live events are back. AB, MFA, Sara and SCW, but Ursa rocked. Awesome. And I love the Spark format. We talked about 20 minutes, 3 rapid fire. Brent took us into Dr. Cooper, one of his mentors, 90 years old, and still spitting it out there with knowledge, facts. Interesting concept with what Dr. Cooper said was incrementalism, small adjustments, view the very poor to poor, poor to fair, Blair's MXM stuff. If you can take your net detractors to neutral, you get a big pickup. If you can take your neutrals to net promoter, you get a big pickup. So focus on incremental improvements and move the dial on those people that need us the most. Connected fitness, I hit on that. There's a difference between exertainment and connected fitness from a wellness format. All are important, but pay attention to that because whatever you measure, you get more of. 2020 is not 1920. Sara talked about all the things we've dealt with in the past with the other pandemics and smallpox and flu and all the different things. Be paying attention to a new reality, but realize that the world's gone through these things before and we'll come out of it strong. Number 5, we hit Chris with the uplifting loneliness kills. 1 in 5 are lonely. We all talked about that and think that was a little bit bigger of a number than that. But what matters is the quality of relationships. And if somebody has quality relationships at 50, they're going to be much more likely to live into their 80s in a quality, happy life. So peel it back, especially with the elderly, but it applies to all populations. Make sure you understand what's really going on with people that are close to you in your life that you love. And so you don't pay attention to just the veneer that people put up, but really get down there and make sure you're there for your friends and family and those you love. Medical wellness, we hit on that. We shared a link in the chat box on our show from September, which had some great programs off the shelf that people can plug and play. We talked about 5 things that influence people with regard to gyms with Brent: location, convenience, the selection of equipment, the value proposition, and being desirable or non-intimidating. I think there's one other in there, Brent, but I may have covered it with that summary.
Yeah, you got it. Cleanliness, I think.
Yep, cleanliness. And so making sure you're useful, usable, and desirable. Sara took us into, I believe, all these different aspects of meaningful work, culture, transparency with your organization on the financials, professional development. All of these things matter. And recognition doesn't have to always be money. Find out what the motivators are. We all have intrinsic motivation and extrinsic motivation. What motivates one employee may not motivate another. So find out what those motivators are so you can hone in on that. There's a phrase that I love, it's better to train somebody and spend money on training them and growing them and professionally developing them and them leave than it is to not train somebody and have them stay. Right? So make sure you're providing opportunities for committees, for leadership committees, for project work. Create meaningful work for people with a culture of transparency and involvement. Lack of involvement equals lack of commitment. So if you're not involving your people, you're going to have less commitment than you would wish. And then Chris brought us home with Les Mills, some great research. We're social animals, twice as likely for people to like live training than virtual. I think that's, again, another underestimate. I think it's higher than that, but 80% like virtual. 100% of the people I survey say they'd love a pool with their fitness center, but only 5% use the pool. So I think virtual is something that everybody wants, but you might not have huge numbers using it, but live engagement with other individuals as social creatures is critical. And I found it very interesting that 27% of the people identified as beginners. I think that's a huge opportunity. That statistic alone is worth your time for the last hour. 27% of people responding to fitness survey with Les Mills view themselves as beginners. How do we help those folks? There's my recap, Brent.
Yep. Well done as always, Bill. Appreciate it. We're going to get into some of the questions. I appreciate those of you that are submitting the questions. If you'd like to do that, you can do that in the Q&A, and we'll try our best to answer a few of them. Before we get started, I want to make sure and thank again ABC Fitness Solutions. They've been a fantastic partner supporting Talks and Takes throughout the entire year. They were also front and center at the IRSA convention. They had a pre-conference on Tuesday that was fabulous and ended with Robert Herkovic from Shark Tank as the keynote, and he was really stellar. They just did a really great job. So one for you, I think I'm going to throw it over to you, Sara. The question is, we are struggling finding group fitness instructors and trainers to join our team. Our pay is commensurate for the area, but we can't find people to apply, or the ones that do have really minimal experience. What do you think? Have some recommendations for her?
I'm going to tell you, SCW started doing something where we will, free of charge, just post on social media your job openings. So you can just email us. I think the best thing, just email info@scwfit.com. And we'll reach out and we'll try to publish some stuff for you free. But this is across the boards what's happening. So we have a few recommendations. One, reach out to your membership and see if any of them were interested in getting certified, and tell them they can do it online now. They can do it on demand, or they can do it live stream. SCW is always offering stuff like that. So does AFA, so does ACE. We've got wonderful organizations out there that are certifying people, offering discounts, so for new people entering into the field. And try to get your experienced people back. Reach out to them. Go into their social media, message them on Instagram, message them on Facebook. That's where they live. They're doing things virtually. They're offering their own on-demand programs. They're training people out of their garage now. They don't think they need you, but they will need you soon. What I've noticed is that as virtual tends to decline, and it is going to decline even more as we open our doors more, reach out to them and try to negotiate and pull them back. Let them continue their on-demand programs and their individual Instagram or Facebook Live programs that they're offering, but embrace them, get them back to the club. Individuals, like Chris noted, our clients and our members will continue with virtual, but they will also go live. It's not one or the other. It's not an on and off switch. It's a dimmer switch. So that's my recommendations.
All right. Thanks, Sara. Bill, the next one for you. We have just automated billing as the biggest technology use in our club. What would you suggest would be the next best move?
Yeah, I mean, automated billing has been around. That was the big technological breakthrough. I think I would probably say CRM, customer relationship management, like tracking your prospect through the lead funnel to become a member, and then the member journey, right? And so if you don't have a solid CRM and a solid member experience management software, then you're probably missing the boat on the full member journey. We mentioned ABC as our sponsor. ABC makes this thing possible. They've got several apps under their umbrella. They've got Trainerize, which is a fitness app that rocks. They've got Gym Sales, which is a CRM that I've used for many years. They got Data Track. They've got Fitness BI, which is a dashboard for all fitness management measurements. And then you put Blair's product with the Medallia platform on MXM, and you have a full suite, right? But you've got to manage the customer journey through CRM, prospect to member journey to member experience pulse of what's happening in your facility. I would say that's the next biggest thing that you got to really hone in on after billing.
Okay. Next one. Can you provide some examples of programming to attract the 80% of the population that we haven't attracted successfully thus far? Programs that you feel like are successful attracting that crowd? Chris, you
Hey,
want to
Brent.
take the first approach, or Bill one?
Well, Brent, we covered this in great detail on our September show, and
Yeah.
me and Mark have shared that link to that show to
Okay.
the audience in the chat box. So there's a ton of programs off the shelf in the September show, and that link is in the chat box, everybody.
Great. I do remember that now. Yeah, we went in depth on that. Okay. Another question is, what are the top 5 things Americans consider when choosing a gym? We missed a few. Bill put it in the recap again. It's, let me remember what it is. It's cleanliness, it's location, value proposition, the right type of equipment, and location.
Convenience.
Atmosphere.
Atmosphere. Yep. So those are the 5.
Non-intimidating atmosphere. Yep.
The next question was, I missed Dr. Cooper's presentation. Was there any other, major emphasis that he made? Chris Stevenson touched on one of them, which was the fact that Dr. Cooper was really promoting the research around vitamin D related to increasing your immunity and a lot of other benefits. So a lot of people walked away getting on vitamin D if they weren't already taking that, for sure. That was a big emphasis of his. That I would have to say probably was one of the bigger highlights, along with moving from the very poor to the poor category of fitness. And then, of course, Dr. Cooper, he always promotes and highlights, his get Cooperized is what he calls it, right? Getting Cooperized. And for Dr. Cooper, getting Cooperized means, all the basic things that we know. It's limiting your use of alcohol. It's not smoking. It's eating relatively healthy diet. It's getting a regular physical exam. It's exercising most, if not every day of the week. It's taking the appropriate recommended supplements that you have. It's managing your stress. And that's what getting Cooperized is all about. So those were his sort of major points.
Hey, Brent, people can watch that whole presentation, right? I think
Yes.
did we put it in the chat box already?
We can do that, which they can get it. All right. So again, we're just a minute or 2 past our mark. Thanks everyone for joining us again this month, November. We'll be back again in December. Chris Stevenson, thank you for stepping in. Fabulous job, sir. Always a pleasure to have you with us, and thank you for doing it. Bill, Sara, we'll see you next month. Bye, everyone.